Well, hello, TNT. Yes, I'm Dr. Jimmy Gutman, a physician from Canada. Although I've lived and worked in different areas in North America, I'm a retired professor from McGill University Medical School in Montreal, Canada, where my original specialty was emergency medicine. More recently, I've been serving as chief medical consultant for a company who makes a unique product called Immunocal, which is a protein that raises a natural substance in your body called glutathione. In fact, glutathione has become my special field of interest. I've written and published more books on glutathione than all of the authors in the world put together. And let me just shamelessly show you my latest edition, which is available on Amazon. I was first introduced to this special molecule in the 1990s when I met Dr. Gustavo Bunos, the discoverer of this remarkable protein. Previously, there were only drugs available to raise glutathione levels, but he discovered a natural protein that did this without side effects and without many other benefits that these drugs did not have. After spending just 2 hours with Dr. Bunos, it became clear to me that I had to pursue the science of glutathione. And it was just too important and too profound not to take advantage of this incredible finding. Just a few words on glutathione. It's referred to as our master antioxidant, upon which the function of all other antioxidants depend on. In addition, it's a major source of cellular energy. It boosts your immune system and is, next to water, the most important detoxification system we have in our bodies. Today, I want to spend a little time discussing the role that glutathione plays in diabetes. I understand that in Trinidad and Tobago, diabetes affects just about 15% of your population. And that just represents the cases that are known. There are likely many more individuals that have just not yet been diagnosed. This is a huge problem, and I suspect it will just get worse. So, what is the problem with diabetes? Is it just an abnormal elevation in blood sugar? Of course, blood sugar levels are high, but what is it that actually gets a patient in trouble? What is it that gets a patient sick? What is it that sends a patient to the hospital or worse, to the grave? It's not high sugar levels, it's the consequences that having diabetes has on your health, which I can divide into two basic areas. Number one, diabetics are by definition immunocompromised. They are much more prone to getting skin infections, toe infections, urine infections, pneumonia, and so on. And as I briefly mentioned earlier, one of the major roles that glutathione plays is to raise your immune system and consequently your defense against these infections. So if you can improve immune functions in a diabetic, you can protect from these infectious consequences. But the second reason, which is far more important, is the effect that diabetes has on your cardiovascular system, your circulation. When your large blood vessels are affected, you're prone to having more heart attacks. You're prone to having more strokes. Diabetics are far more likely to die or suffer from a cardiac arrest, a heart attack, a stroke, or cerebrovascular accident. It gets worse when you look at the small blood vessels, what we call the microcirculation. When these become affected by poor circulation to the eyes, you get diabetic retinopathy, the leading cause of blindness. When the circulation to the kidneys gets affected, you get kidney failure or renal failure, also the number one cause of kidney failure. When the circulation gets affected to the nerves, you get neuropathy and so on. So What's going on here? Let me explain. Because diabetics have a high blood sugar, this changes the environment of their blood so that they have higher levels of what we call oxidation. They have higher levels of oxidative stress and free radical formation. Now, we all have fats that circulate in the blood, the most notorious of which is cholesterol. When these fats, like cholesterol, are exposed to free radicals, they easily oxidize. This oxidation is called lipid peroxidation. What this does, it turns cholesterol stickier, so to speak. This stickiness causes cholesterol to gum up the vessels and to lead to plaque formation or a partial or complete blockage. So, diabetics who have higher levels of oxidative stress are more prone to the development of plaque formation or hardening of the arteries. Where am I going with this? Well, we all have another substance in our blood that prevents lipid peroxidation, that prevents the rate of hardening of the arteries or blockages. This substance is called glutathione peroxidase. And if you raise your glutathione levels, you raise your glutathione peroxidase levels, and you're able to ward off the damage done to your blood vessels. So we're not trying to lower your blood sugar level using glutathione. What we're trying to do is to get to the root of the problem. We are practicing true preventive medicine. We are protecting you from the consequences of having diabetes. True preventive medicine at its best. So what proof do I have of this? Well, as a practicing physician, I can't just suggest something that I think is interesting or based on theory. I need to present what has been proven by research. The most reputable source of research articles available in the world is a site offered up by the American National Institutes of Health, something called pubmed.gov. Those of you who do research out there listening in will certainly visit this site on a regular basis. When you enter the keywords diabetes and glutathione on this search engine, you'll get over 7,500 published articles, all of which represent original research papers on diabetes and glutathione. Let me just show you some of them. First off, what evidence is there that diabetics suffer from increased oxidative stress? Well, that one is very highly documented with numerous papers. What evidence is there that diabetics are glutathione deficient? Here we see an article that for sure shows that. Here's another one from way back in 1995. Here's one that shows that this drop in glutathione levels actually correlate with the degree of complications of diabetes. This article, among many others, have found that people with abnormal glutathione genetics are actually more prone to the development of diabetes. Can raising glutathione protect against heart disease? Yes. Here's a glutathione precursor called NAC that was used in this article to prove it. Are there associations between glutathione levels and stroke in diabetics? Yes, there certainly are. What about kidney disease? A bunch of articles. What about diabetic neuropathy? Can raising glutathione help? Yes, again, yes. So you can be comfortable that this approach has been thoroughly researched. The association between glutathione deficiency and the presence of diabetes and diabetic health complications is well established. I suggest to you that you take a very good look at the strategy of raising glutathione if you are a diabetic. To health.